Good evening. Where do I begin? I really have no words to start. It's been an amazing journey with a great friend, Dr. Joseph Fidelis. I stand here representing the Global Patient Safety Organization, the consortium of accredited healthcare organizations, where Joe was an integral part and he will continue to be an integral part. As part of the family, Dr. Joseph, Lallu Joseph, Mishal and Madani, who have become integral part of the Tirunelveli family. He's been instrumental in everything. I stand here in total loss. However, what Dr. Joseph Fidelis left behind, I'm sure is going to stand forever. So let me begin my journey and the journey of this beautiful organization, CAHO, with Dr. Joseph Fidelis. This is the very first picture in 2017 that I took with Dr. Joseph Fidelis. Let me call him Joe. I can never call him Dr. Joseph Fidelis. This was taken at Meenakshi Mission Hospital. I got a call from Doreen and Bernard saying there's a very young boy who has come into the family of AVH hospitals. He's come straight from global hospitals, from a corporate setup, unable to fit into the family setup. He needs to be trained. He has to have a lot of training. And he's one individual who's full of energy. So I'm going to send him to Meenakshi Mission Hospital to attend the basic CPQH training program, the 3-day training program. And this was between 26th and 28th of August 2017. I entered the hospital a little later. The morning session was handled by Dr. Anna and Dr. Saravana from Mehta Hospital. So I entered around 12 o'clock and they told me there's one person sitting in the front. He's going on asking questions, madam, be prepared. He's not allowing the class. So by then they had finished only one chapter. I said, what happened? I said, full of questions. So we were answering. So I said, okay, let me handle. So the session started and I saw this chubby young boy, an anesthetist. He used to be really chubby then. And he had a black t-shirt. The others were all in, shirt and pant, very formal attire. He had a black t-shirt that read, my awesome sister gave this to me, something towards that. I think it was given by Gina or Jane, I don't know. So this black t-shirt and a jean, torn jean. So I thought, that's it. What am I going to do? So he went on and on and on, non-stop, starting from broad debt policy to emergency management, medico-legal cases. I patiently answered to everything. By afternoon, we completed only the second chapter, COP, care of patients. And by evening, he gave a smile before the class finished. And then he went off in a Benz car, driven by a driver, and he had everything there. We didn't look this side. I said, okay, pampered child. He left. The next day in the morning, he came. That time, he was like this. This was the shirt. So I thought, okay, slowly somebody is coming to shave. So he came, nothing at all. He didn't say anything. He was just listening and taking notes. By that evening, he said, can I have a selfie with you, madam? And he came and took a selfie, this beautiful picture that I cherish forever. And the third day, he sat and then came and asked me, ma'am, can I have your mobile number? I said, take it. I gave the number and he said, I won't disturb you at all. He never disturbed me. And after 2 months, I got a call from him saying there's advanced CPQH happening in Delhi and I'm eligible to attend. I said, please come. So he came, 4-day training program. By then he would be asking questions, sending some messages, asking for what about these forms, how do I implement? So when he came for advanced CPQH, I told him, I think Dr. Joe, you should start wearing white shirt and blue pant and very formal attire. Believe me, the next day he went and bought white shirt and blue pant, and I think he continued with that for many years. That became his trademark, to the extent that one day I slowly told him, maybe you should wear a baniyan also. So he went and bought that as well. And another day I told him, why don't you wear a tie? You look very, very smart. And he did that. So such was the relationship that was with this amazing friend of mine. To talk a little bit about Joe, a very keen learner. Anything and everything he'll want to learn. The very first program he'll attend. We started the risk management program and he was there promptly as the first candidate. He just wanted to learn and learn and learn and pass it on to others. I realized he was going and taking sessions to all his small and medium hospital friends. He will take the notes, he will go share it. Very adaptable to change. He wanted his hospital to become like a corporate setup where he came from. The practices to change. That was his aim. He kept saying, I want protocols, I want policies change, I want manuals, I want SOPs for everything, I want checklists. And IT enablement was his dream. He wanted the best of the software to be brought in. He started with some blockchain initiative to help small and medium hospitals. He will go learn everywhere. He'll go to Kaveri, he'll go to Apollo Hospital, he'll come to CMC, learn everything so that he can actually develop something and give it to all his friends and small hospitals. The love for the family, amazing. He will start and end about his family. He will keep on and on and on talking. I never met Dr. Gigi or Dr. Roy or Dr. Raju or his grandparents, but I knew everybody, starting from the little ones in the family. And all of us who have interacted with him, even without meeting the people in the family, we knew everyone. And he kept saying that he wanted to build the legacy of his grandfather here. He adored his grandfather, his grandmother. Maybe he was brought up by them. And the entire family. He kept on and on and on saying that I am the next generation and I have to build this empire. Willingness to help anybody and everybody. You ask for money. I have sent messages to him during COVID saying this person needs money. Can you support him, Joe? Very next minute, money will be transferred. It may not be just money, but even his time, his efforts, to the extent that one of our friends, our state representative from Assam, has a very major cardiac issue. So he called him 15 days before his death and told him, when you are coming to AVH Hospital to do your surgery, I am going to be there for 1 week. He would just be available. I was admitted in ICU, he came running. Anybody, 100% there to support, to help. Respect for talent. I don't know how he identifies people. He will go pick up the best people in the field and bring them. He listened to Shivramakrishna's lecture one day and told me, Madam, this man is amazing. And the next meeting I realized that he had brought him into the family setup to learn about their finances and how to help them. Whether it is Dr. Jala or anybody. He wanted to always shadow Manivandan for some time to see how Kaveri functions. He really identifies talents in everybody and then tries to learn out of that. A perfectionist, a stickler for quality. He wanted SOPs, he wanted protocols, he wanted everybody to follow. And people don't follow, he gets upset. So I used to tell him, culture takes time. It's about 10 years for the culture to come in. Don't get upset. But he wanted everything then because he was a perfectionist. I used to tell him, you have some OCD, go check out. So that was Joe. I can go on and on and on talking about Joe. The last 2 years, he was into humanizing healthcare ever since COVID happened. And he saw the plight of patients who were treated, in ICUs. he developed this overall thinking about humanizing healthcare in a big way. This was something that he sent to me. When I asked him, what is this going on and on about humanizing healthcare? He told me something known as PICS, which I didn't know, the post-intensive care syndrome. And he said, Madam, do you remember when you were admitted in ICU, you said the patient next bed died. And that morning, they were preparing the bed, they were emptying. So the whole fear factor that was in the next patient, that was me, was too much. So I told him that sitting in ICU is not easy. That 1 hour was so difficult till they moved the patient, the deceased out. So he said that is exactly the post-intensive care syndrome. And he was focusing too much into humanizing healthcare. And he gave me these definitions as to how you can humanize ICU, requiring mindset and cultural shift, open ICU and visiting policy. So I'd say you are going to increase the infection rates. Say no, more than infection rates, the patient's relatives' presence makes a huge difference. There are studies available. Multidisciplinary teams. He was very, very, proud of his team. His technicians, his nurses, he would talk to them, take them for coffee. And he always said it is the team that has to work together when it comes to patient management. He was really looking into natural ventilation. So when the new ICU was built during COVID, he told me that room doesn't have any natural ventilation. So when I built my new hospital, I will have it all, the ICU will have complete natural ventilation, ICU, natural lighting. And he was actually planning towards that. Noise reduction in ICU. All of us know increased access to natural light and helps in regulating the circadian rhythm. And that he strongly believed in that. And he also said in case the light is not adequate, you can explore other possibility of bringing in natural light. Noise reduction, alarms. So he kept on and on and on talking about humanizing healthcare after his experience in COVID. I think he managed several lives during COVID. And he kept telling me, if something happens, you'll take me to CFC, isn't it? You'll bring the ambulance and take me to CMC. And he used to tell me, ma'am, don't go near the ICU, because he was always scared that I will get something and get into ICU. It was such an amazing friendship that we had. The day always started with Joe's phone call and ended with Joe's phone call. He had a passion for small and medium hospitals and their survival. And that is the main reason as to why we thought we must launch this forum here today. It's because of him and some other people in CAHO governing committee that we realized that the small and medium hospitals really struggled. I could have come from a hospital 4,500 beds. Father Johnson has 600 beds. So we really do not know to that extent the complexity of small and medium hospitals. Till I actually was put in as advisor for Annavelamani Hospital and some other hospitals. So to him, he always felt accreditation is a starting point and that can really help and put systems in place in small and medium hospitals. So he was supporting more than 9 hospitals in the region, Dindigul, Madurai, all his friends, juniors, small hospitals. He was helping them with protocols because he strongly believed that accreditation can actually set good governance in the hospital, good systems and processes so that the outcomes are better. Administrative training for small hospital owners. He joined for MBA in hospital management because he said, as a clinician, I was never taught how to manage a hospital or manage finances. I could never read a balance sheet. So he joined for the BITS Pilani program along with CMC and he excelled. His project was wonderful. I was his guide, the proud guide of Joe, that was published in an index journal. The first study on risk register for India. We identified 74 unique risks in the country. And that's a published paper that's available. Because he put his heart and soul into it to develop the risk register. It took 3 years to complete the study. He always wanted a very simple hospital information system so that the staff in the small and medium hospitals don't have to struggle something that he can identify so that the other hospitals can actually use. He was preparing towards that. He would always go and identify from other hospitals which is the best HIS that we are using. Dashboards. So he will show the car and say, I gave the example of a management dashboard, like the car dashboard. So he'll say, my dream is to have a dashboard like this for my hospital, looking at the ARPOB, or average length of stay, or the clinical outcomes like SSIs and CART and VAP and whatnot. He wanted a dashboard that could be then used by small hospitals. Medico-legal issues, his passion. He used to talk about consents, how to take consents, how to actually develop consents. That used to be his, very, very close to his heart and very passionate about concerns, medico-legal issues, and how you can engage with patients so that mob violence and other issues can be reduced. So he identified these 5 areas for the small and medium hospitals that one can work on, apart from the operational issues. This was the last picture that I took with Joe. The first to last. We've had several road trips. We've gone to 4 countries. Lots and lots of friends in the country. Invariably, every 3rd month, we will decide to go somewhere, pack our bags, go stay in Mahabalipuram, about 14, 15 of us. Many of them are here. Lot of fun, sharing, networking. So we had a close group that was able to really relate well, and we all miss him. It's not just this group, the entire CAHO family misses him. We are about 147 people in the governance of CAHO, and he has touched everybody's lives. He would go talk to everyone. He will interact with everybody, and we really, really miss our dear Joe. This was the last photograph we had in my house. He had come for he couldn't come for my birthday, so he came on the 13th or 14th to arrange Jane's wedding. And we had a cake cutting, Jane, Vivek and me, and this cake was arranged by him. And he said, ma'am, sir will not buy you a Valentine's Day cake. I know for sure he would have forgotten it's Valentine's Day. So now on behalf of sir, I am bringing this cake for you. Both of you please cut the cake. And he made us cut the cake. Jane, do you remember the lovely day, the lovely cake that we had? And the last message that he sent to me, of course, the day before he passed away, there were several messages and so on. But this message was very close to him. This is from his teacher, is what he told me. Apparently this teacher wrote a message in one of the social media handles or probably put up, I don't remember exactly. So he was very, very proud of his hospital. So he said, ma'am, do you know, this person has written a feedback like this. It's a very disciplined hospital. Every staff is sincere. The hospital is always clean. The canteen is maintained. Workers in the canteen are very sincere. This hospital gives much importance to God. So naturally, God bless the hospital always. Dr. Abhisai sir, Dr. Joe, Dr. Haji were my wife's students. Security staff were very nice. Probably Mr. Kishore from front office, very well disciplined and caring person until we left the hospital. So this was the feedback that he shared. And he was very proud. After that he passed away 2 or 3 days later. So I think he wanted this feedback. He would always complain about some negative feedback, and this was the first time he shared a very positive feedback. That was probably a sign. To always remember Joe. We strongly believe as an organization that clinicians will have to lead quality. Clinicians will have to stand in the front to lead quality and patient safety. We can only be channels. And this was one exemplary clinician who led from the front. As a model, as an example for young clinicians who are coming into quality and patient safety. So as an organization, the Consortium of Accredited Healthcare Organizations decided to launch this award and this will be presented. There are several applicants to this award this year. This will be presented on the 12th at Delhi by the Honorable President, most likely. This is the Young Clinician Leader in Quality and Patient Safety, Dr. Joseph Fidelis Memorial Award. We are extremely proud as a nation of this brilliant soul. He brought about quality patient safety in the minds of clinicians. There are several clinicians who are following his footsteps into this journey of quality and patient safety. You shared with so many of us. As a healer, you tended to both bodies and souls, bringing comfort and hope to those in need. Though you may be gone, your legacy remains and will always remain a guiding light of compassion and dedication. Rest in peace, dear Dr. Joseph Fidelis. Your love and wisdom will forever be our strength. This is from the whole governing committee of CAHO. We will always remember Dr. Joseph Fidelis and will always appreciate and be part of the family of AVH Hospitals. Thank you.
It's been a long day without you, my friend, and I'll tell you all about it when I see you again. We've come a long way from where we began. Oh, I'll tell you all about it when I see you again. When I see you again.
Damn, who knew? All the planes we flew, the things we've been through, that I'll be standing right here talking to you about another path. I know we love to hit the road and laugh, but something told me that it wouldn't last. Had to switch up, look at things different, see the bigger picture. Those were the days, hard work forever pays. Now I see you in a better place. How can we not talk about family when family's all that we got? Everything I went through, you were standing there by my side, and now you gon' be ready for the last ride.
It's been a long day without you, my friend.